Hi, nutrition students. Let me get my screen share ready, and we've got our slideshow. So today we're going to talk about Chapter 13, Nutrients that Support Blood and Brain Health. We'll start with the blood, vital for life, essential. It is a transport medium that moves waste and nutrients and oxygen and more around the body within the circulatory system. What I think is very important here is this slide and its highlighting of all of the nutrients that are important for the development of the blood cells and the health of the blood cells. So you can see quite a number here. We talk a lot about hemoglobin when we talk about blood and anemias, and for good reason. Of course, the hemoglobin is the iron-containing red pigment protein in the red blood cells, and it carries the oxygen around the body. Therefore, when hemoglobin levels are lower, we see symptoms having to do with that deficit of oxygen and hemoglobin. There are two major types of anemias that we will discuss in terms of nutrition: a macrocytic anemia, which may be caused by a vitamin B12 or folate deficiency. And in this macrocytic or large cell anemia, we see large, immature, underdeveloped cells that can't do red blood cells, that can't perform their functions well. In a microcytic, small cell, hypochromic, low color anemia, which may be due to an iron deficiency or a B6 deficiency, we see small pale red blood cells. Now, there are quite a few nutrients, micronutrients that support blood health. We are going to focus on 5 of them, starting with vitamin K. So a couple interesting things about vitamin K. It can be synthesized by gut bacteria, and we'll see the significance of that in just a minute. It's important for blood clotting and for bone health. A deficiency, and this is related to the synthesis by gut bacteria, is seen in infants because their gut is sterile, and that's why they're given an injection of vitamin K after birth, or in adults who have been on antibiotics for a long period of time because of the impact on the gut microorganisms. And also whenever you have fat malabsorption. Remember, when fat is malabsorbed in a disease like cystic fibrosis, not only fat is malabsorbed, but also the fat-soluble vitamins. Take note of the recommendation for vitamin K, although on an exam, I would never ask for a number in terms of the recommendation. Also note that there have never been reports of a toxicity. So something that often happens is that students throw a lot of greens into their diet when they're working on their nutrition applied for unit 4 and 5, and vitamin K goes sky high and they panic a little. No need to be concerned because there is not a UL value. However, patients who are taking blood thinners like Coumadin that are specifically intended to thin the blood. Okay, we want to thin the blood because perhaps this patient has had a number of mini strokes and we're trying to prevent them. The doctor works very hard to get the blood thin enough, but not too thin. And then if the patient goes home and throws a lot of greens and Brussels sprouts and cabbages into the diet, that can cancel out the effect of the blood thinner and get the blood clotting again, and that patient prone to those TIAs or mini strokes. So most of us, vitamin K, the more the merrier. They've actually shown the more of these foods that we eat, the lower our all-cause death rates. But for patients taking this medication, it is a different story. Here's some food sources. And I think what's interesting to note is how high the vegetables are compared to the other groups. Okay, let's look at folate, important for DNA and cell division and metabolizing amino acids. And this is an interesting one in terms of its forms. The synthetic form of folate is folic acid. That's what you find in fortified grains. Folic acid is absorbed better than folate. This is why pregnant and women planning pregnancies are advised to take a supplement, because that's absorbed better than the folate found in food. So folate deficiency causes that macrocytic anemia, which you see described here. Okay, the cells grow large but don't divide as they should. And the symptoms are also listed here. A lot of these are common with other anemias as well. In pregnancy, folate is very important for closure, the enclosure of the neural tube, and that happens at about 28 days. Adequate folate intake or folic acid intake lowers the risk of that closing incompletely, and that incomplete closure causes serious birth defects like spina bifida and anencephaly. So what we want, the third bullet here, is that all women take enough folic acid before pregnancy to make sure they have enough on board to cover that very kind of early important milestone there. And for that reason, we're also fortifying grain products so women are getting more of the folic acid that they need. There's a little bit of concern. This is just an aside. I don't think it's covered in your textbook, that too much folic acid could increase the rates of cancers. Okay, if you think about folic acid helping cells divide, this is not a good thing if you have a cancer cell. Okay, so some people are concerned about too much fortification for that reason. Please note there's no concern about the folate in food because it's absorbed at a lower level. Getting enough folate, there's some numbers listed there just so you can have a kind of ballpark, but you'll see that folate's found in vegetables and orange juice and fortified foods. Cooking does destroy quite a bit of it. And here again, we see sources of folate. Now I'm going to flip back a minute. You see here 400 micrograms. And let's look at these fruits and vegetables. What becomes pretty obvious is that one serving is not going to do it. And this is a problem with folate in this country and why fortification really took place, especially with those birth defects in mind, that we see that the numbers of fruits and vegetables commonly eaten is not providing enough folate. Okay, on to B12, which is often discussed after folate because it participates in folate metabolism. B12 is important for maintaining the myelin sheath. Okay, that insulates the neurons. What is very important about B12 is that in order for it to be available from the diet, bioavailable, in order for you to use what you consume, several factors have to be in play. So let's talk about that. When you consume a food with B12, and let's start there, B12 is almost only found in animal-based food, meat and fish and eggs and milk. So right at the start, vegans have to make sure that they have a source of B12 from fortified food, a supplement, or something else in their diet, okay? But when you consume that meat, egg, fish, etc., the B12 is bound to a protein. We need to take it off the protein in order for it to be absorbed, and stomach acid is necessary for that. So very important, people who have low levels of stomach acid might have a problem with B12 absorption. That includes the elderly, and that also includes people taking antacids, powerful antacids, like the proton pump inhibitors. All right. We also have another factor that is necessary, and that's the intrinsic factor made in the stomach, attaches to the, and you can see that here, all right, and here, made in the stomach, attaches to B12 in the small intestine so that it can be absorbed. Some people, and the elderly fall into this category, as well as others who have had stomach injuries or stomach surgery, or just for unknown reasons, stop making enough intrinsic factor. So that can cause a problem with B12 absorption as well. Now, a deficiency causes the same anemia that we see with folate absorption, because it works with folate to reactivate it, but also much more serious symptoms of nerve system damage. So we see everything from paralysis, we see problems with reflexes, problems with memory. So preventing B12 deficiency in those susceptible groups or groups at higher risk is very, very important. Now, how do we do that? Well, certainly diet, but again, most of us consume enough in sources, besides, of course, perhaps vegans. The problem seems to be more with absorption. So people who may have low acid levels in their stomach should take a supplement containing B12, because you don't need the acid because it's not bound to protein. So this is good advice for people who are elderly or those taking antacids routinely. Individuals that don't have enough intrinsic factor actually need to have injections of B12. A lot of people get injections of B12 who don't have a deficiency. B12 injections give you a burst of energy, so you feel like something's happening, but it's really more of a placebo for many that are receiving those injections. Okay, so here you see the sources: fortified breakfast cereal, and then those animal foods. And that's why we kind of hone in on the vegans. And here again, sources very, very low in everything besides those fortified grains and also the protein foods from animals. All right, on to iron. Lots about iron as well. Okay, iron's part of hemoglobin and myoglobin, also needed for, all sorts of reactions in just about every cell in the body, for our brain system or immune system, for drug detoxification, for collagen synthesis. So very, very important. It's also the most common micronutrient deficiency worldwide, 30% of the world's population. And the causes of that are several. One is whenever you have the production of more blood volume, you're at risk. Whenever you lose blood, and that's why women who are menstruating are higher at risk, or other blood losses increase the risk of deficiency as well. Iron is very interesting clinically because the signs and symptoms of deficiency are so varied. Of course, you've heard about people with anemia and how tired they are. They may also have headaches and just not be able to do what they typically do in a day. It impairs immunity, so the client is getting sick more often. It can cause those spoon-shaped nails. Because iron is bright red, you can see a pale color lining the eyelids, also in the nail bed, sometimes in the complexion as well. And inability to regulate body temperature is also quite common, always being cold, even when it's very warm outside. Another is a craving for ice, okay? This is very common with iron deficiency anemia as well. An unusual craving to be chewing on ice, throughout the day. Keep in mind that iron deficiency does not occur, or iron deficiency anemia does not occur overnight. There are several stages of this. First, the stores become depleted, and then the amount that transferrin is moving around the body becomes depleted as well. In the second stage, before anemia, you can have some symptoms of anemia, okay, some physiological symptoms. And in stage 3, we see these small pale red blood cells. Now, we also focus in on iron because the needs differ greatly between women and men, and it puts women in a little bit of an unusual situation. Women tend to eat less in terms of calories than men, but we need much more iron. So it's easy to fall short, especially if you are not consuming a lot of meat foods. Absorption depends on a number of things. When you are deficient, you tend to absorb more. We'll talk about the forms of iron, and we'll also talk about the other dietary components as well. The body tries to hang on to iron. The only significant loss is through bleeding. So that's why, again, women who are menstruating are at risk for iron deficiency. All right, so we need to talk about heme and non-heme, the two forms of iron. Heme is much more highly absorbed than non-heme, and this is a form we find in animal sources. So think about heme, hemoglobin, red blood cells, and then that makes sense. Non-heme is the type in plant sources, fortification, and also supplements. Here's the interesting thing. Non-heme iron is influenced, its absorption is influenced by what you're consuming at the same meal. So if you consume vitamin C with your non-heme iron, that increases the absorption significantly. If you eat meat, fish, or poultry, even a bit, that increases your non-heme iron absorption significantly. And the tannins found in tea decrease the absorption of non-heme iron. Doesn't apply to herbal teas. So the suggestion is to drink tea, and by the way, typically coffee as well, because of substances in the coffee. Drink tea and coffee between meals, not with your meals. Oxalates and phytates, again, can decrease the absorption of iron, as well as very high doses of calcium. Here we see food sources of iron. But remember, with iron, bioavailability is really crucial. So you have to focus not only on how much is in the food, but how well that is absorbed. At the same time, consuming too much iron can not only cause stomach irritation, but can actually cause death if you're consuming the amounts in supplements that, many supplements. So for instance, if a child got a hold of the gummy vitamins with iron and ate a whole bunch of them, that's time to go to the ER. Okay, so this is a problem. There's a genetic disorder called hemochromatosis, in which individuals can absorb a whole lot of iron, and it actually causes a negative effect on all of their organ systems. So too much iron is a problem. We're also seeing a correlation between stored iron and type 2 diabetes, as well as some brain disorders like Parkinson's and other brain issues. So we need to be careful with that as well. The UL is 45 milligrams per day. On to copper, which tends to kind of sit very closely to iron because it has very similar functions, and you see that here. And we kind of see similar deficiency symptoms as well, right? So this is one of the micronutrients where another micronutrient can cause an imbalance in a deficiency. So if you consume too much zinc, you can actually cause a copper deficiency. Getting enough copper, a little bit of overlap with iron. And food sources. So let's look at this as well. And you can see clearly that these protein sources are very high in copper, but there's some good amounts in others as well. Now, this is interesting. Overdose, not from food, but from supplements, can really do some serious damage here. And there's actually a disease in which the liver cannot synthesize ceruloplasmin, and copper accumulates in tissues, and this damages both the liver and the nervous system. So remember Wilson's disease, the reason this eye is up here is because this little kind of copper colored ring is seen in copper toxicity, which is interesting. All right, one of my favorite areas of research to kind of end up this chapter, and that's nutrition and brain health. But I was a little disappointed in the text because it didn't dig into the area I think is most exciting, and that's nutrition and mental health. And that's why you have that as one of your discussions, to do a little bit of research here. So you will read some facts about the brain. It's very metabolically active. 20% of the body's blood goes to the brain. We know that, all of these nutrients we've talked about, or almost all of them, are very important for brain health. We see an effect with omega-3s and omega-6s. We know that choline, our newer vitamin, is very important for the nervous system, nervous tissue. Iodine, iron. We know that the brain prefers glucose and relies on glucose as a fuel source. And when individuals fast, we see that the glucose is derived from liver glycogen and then amino acids that are broken down to provide that glucose. During starvation, so a longer period without food, we see that the brain uses ketone bodies, even though high levels of ketone bodies, we talked about this, can cause acidosis. So, we've got the whole lineup here. All of these micronutrients are required for healthy brain function, and deficiencies can impact that brain function. There is a researcher out of Calgary who is doing research on micronutrients and some mental health disorders and finding good results with supplementation. So there's this kind of emerging area of a lot of these micronutrients for individuals with some of those mental health conditions. So her name is Bonnie Kaplan. You could look into her research. We know that antioxidants protect our brain. They're very important, as well as tamping down inflammation as well. So here are a couple of things. I think this is important enough to spend a minute here. Besides antioxidants, we know that high levels of homocysteine is a risk factor for cognitive decline. Okay, and we also know that folate and B6 and B12 bring down homocysteine. So back to the importance of those vitamins. We know excess body fat and insulin resistance and sedentary behavior also increases risk of cognitive decline. So it's the same information we've been talking about, right? But now with its effect on brain. There's been a lot of research that has come out about how important nutrition is for nervous system development during pregnancy, and poor maternal intake of a number of nutrients have been related to cognitive function in the offspring. So this is something we'll be talking about in the next unit. The text talks about migraine a little. Some migraines are improved or reduced, I should say, when the diet is altered. So there are common triggers for those migraines. By the way, ginger, okay, the dried ginger, you can look into the research of that. I think it's a half a teaspoon has been shown to have an effect on reducing migraines. Okay, now I will mention this and probably mention it again when we talk about the elderly. When we talk about the brain, very often the focus is on Alzheimer's disease and other types of cognitive decline with aging. We now have a diet that's a combination between the Mediterranean and the DASH diet that has been shown to dramatically reduce the risk of cognitive decline with aging. The diet looks like this. It's focused on these brain healthy foods, which are good for you at any age, not just as you're aging, and a limit to these foods. Okay, so again, that plant-based healthy diet with loads of phytochemicals, loads of anti-inflammatory compounds as well, staying away from the ultra-processed foods and the foods high in saturated fat and added sugars. I did want to, before we end here, so this gives you a summation of the nutrients that are important for brain health, but I did want to make mention of one more area, and this is what you'll look into in your discussion. We also know diet seems to impact mood and mood disorders like depression, anxiety. We also, as part of that, know that an ultra-processed food diet increases the risk of those things. And you can look into the research. If you're interested in books on this, I've read several, and I'd be more than happy to share the titles of the books and the authors with you. So changing your diet to more plant-based and pushing out those ultra-processed foods high in unhealthy fats and added sugars and sodium does more than prevent chronic disease, even though that's kind of enough. It helps you feel better tomorrow. Okay, and that's what I think is so important. And they've done research in all age groups, from teenagers to young adults to adults. This will make you feel better. And I think that's nice to have something that you see the effect of this earlier rather than later. Okay. So thank you. Have a great day.